Hello and welcome to today's workshop. My name is Rachel Joy Olson, and I will be taking you through a little training on the impact of flexibility training on performance. So, we're going to be talking about the importance of stretching and maintaining and improving flexibility over time. So, I'm going to start by reviewing 5 essential components of physical activity that are very important. And most of them people know. Okay, so the first one is cardiovascular endurance, really important aspect of fitness. And that's, of course, for its whole other topic. Muscular strength, muscular endurance, of course, that's resistance training, building the lean muscle mass on our body. Body composition, so that is the ratio between fat mass and lean mass. And then, of course, flexibility. Now, flexibility is one of the 5 essential components of physical activity that most people overlook. So, for a lot of the times when I'm teaching, let's say, a group fitness class, a lot of people tend to sneak out just before that flexibility component, which is really unfortunate. And they're doing themselves a disservice by doing that because that flexibility training is what helps that body recover and repair a lot quicker. And we'll talk a little bit more about that as we go along. So, what is flexibility training? So, flexibility is the ability to move through a complete range of motion. Okay, so let's say we take the shoulder, right? We bring it up and over, we bring it off to the side and back, right? We bring it behind us and out. The ability to move through that full range of motion is flexibility training. Of course, as we already mentioned, it's one of 5 essential components of fitness, and it is the most overlooked but provides the most benefit. A lot of people find when I've worked with personal training clients before, they've talked about how I can't improve my strength. I feel like I'm at a plateau. And then if I do an assessment on them, I usually can see that it's flexibility training that's actually the problem, and it's what's holding them back. Once we start getting into a program of regular flexibility, their strength improves. So it's pretty cool stuff. So, some factors that affect flexibility include joint structure. So, our bones are only going to move so far, right? So, let's say, we move here, and all of a sudden I can feel some pushing into some pain right at the joint, right? It means that the bones are actually connecting to one another. So, often we need to kind of come around the joint, right, to do that. Let's say we are stretching here in butterfly pose and we're really working on pushing those knees down, but yet you feel it right in this hip here. It's not here per se, it's the pain right in the joint. So if you feel that pain in the joint, that's where you know your joint structure is causing you to stop. So there won't be any more improvements in flexibility at that point. However, if you feel that the muscles are straining, let's say here, but you don't feel it in the joint, it means these guys are tight and you can push a little bit further. Okay, so you can't improve the range of motion past your skeletal structure. So what you're born with is what you have. However, we can lengthen the muscles and the connective tissue. So that leads me into connective tissue, which is the fascia, tendons, ligaments, those sorts of things. So ligaments are really designed as really tight connective tissue. They are designed to not have a lot of movement. There's going to be a little bit in there, but not a lot, because ligaments are meant and designed to hold joints together. So let's say we've got 2 bones here. The ligaments are in between those bones, holding those bones together. Tendons connect muscle to bone. So they are actually connected, they're attached to the bone and connected to muscle. So they're going to have a little bit more give than, say, a ligament, but not much. Again, right? It's the stretchy tissue of the muscle that actually will stretch. And then fascia. So fascia is a connective tissue layer that's basically it's through our entire body, and the fascia will hold the compartments of the muscle together. So fascia, over time, any of these connective tissue will lose water. So especially if we've spent, the majority of our life in chronic dehydration, which unfortunately a lot of people do, you'll lose water and lose flexibility. So it's really cool when you look at connective tissue or fascia under a microscope. You'll see that it's almost these little, it's like a mesh, right? And you'll see you'll see water droplets almost like kind of flowing in between the mesh pieces. It's very, very cool. So it's really important in order to have that lubricant, right? So that the fascia fibers can slide within each other. We do have to have that hydration. So of course, hydration is very important. It takes longer for connective tissue to stretch out. So a lot of the times, if people have developed a stretching program but they're not seeing any improvements, it's likely because that connective tissue has not been given the time it needs to lengthen. So connective tissue takes at least 3 to 5 minutes of holding statically to lengthen. So if you hold for 30 seconds or 20 seconds or 10 seconds, which most people do, you're not digging into that connective tissue. You are going to get into the muscle tissue for sure, but not that connective tissue. So once you hold that 3 to 5 minutes, it starts to release and lengthen. But the cool part about once we lengthen that connective tissue, it takes 72 hours for it to start to return back. So if we do a program of regular long stretching, eventually they'll just, the new normal for the connective tissue will be in that more lengthened state, helping with your range of motion. Then, of course, another factor that affects flexibility is muscle. Okay, so that's the big bulky muscles can get in the way of range of motion, and of course, certainly, if you've ever seen anybody who's really big and lots of muscles, they often, can't reach behind their back, and they can't, reach here to give themselves a scratch in between the shoulders. It's just a lot of the times, a couple of reasons, the muscles are just big and bulky, and they're kind of getting in the way. And second of all, there probably hasn't been a regular practice of flexibility. So, really important. Another factor is gender. So, due to bone structure, women are usually more flexible than men. It's just the way we're built, especially in that hip area. So, even though we might be more flexible than men, it doesn't mean that only men should be stretching. It means everybody can benefit from a regular practice of flexibility. Next factor is age. So flexibility decreases with age. Okay, so it's partly due to the degradation of tissue, um, and also dehydration, right? So, collagen starts to degrade, the hydration levels become low often. So it's really important that as we age, we keep up with that regular activity and flexibility. Skin studies show can affect about 2% of flexibility, which is kind of interesting. Of course, it is the biggest and largest organ in our body. Body temperature can affect flexibility. That's why it's important to stretch when we're warmed up a little bit. So it doesn't have to be a lot, but you'll notice that, let's say you get up first thing in the morning and you're cold, you're a little bit tighter, right? So that cold tightness, especially in the morning, is something that you want to maybe stretch after a shower or just do a little bit of movement before you get into your big stretches. Another thing is too is during the evening and when we sleep, that connective tissue actually starts to form new little webs and connections with each other. That's why, our body naturally wants to stretch first in the morning, and sometimes we can kind of feel or hear snap, crackle, and pop. A lot of the times it's some of those newly formed connective tissue that has to be kind of released. That's why if somebody, let's say for example, breaks the shoulder and then they're in a sling for a while, they can get something called frozen shoulder. And what that is just connective tissue starts to bind together. If we don't move our body, it will start to solidify, right? That connective tissue just comes around the joints and it's even harder to release it. Pregnancy is a big one for flexibility. So, relaxin is a hormone that causes the joints to relax and become more flexible. Of course, this is to help baby come out. But pregnant women can be at risk of injury if they push too far because it's almost a false sense of flexibility. So, pregnant women will have to be careful with that. So, what are some benefits of flexibility training? Well, there's so many. So, we'll just run through a few of the benefits of flexibility for you so you know why it's important to start a practice of stretching. So, improved performance on daily activities, Improve performance in exercise and sport, because the more flexible you are, the more limber you will be, the more agile you will be to move around. So in order to achieve peak performance, we must really utilize the full length of the muscle, right? Because if it's at optimal length, we get the most power and strength. So let's say we've got muscle structure. It's called a sarcomere deep into the cellular tissue. But let's say it's in a optimal state. That's where we get the most power contraction, the most strength. Now, let's say it's lengthened too far. We've got too much length, right? So it's going to lose its power because it's got to take a little bit more time to come together for that contraction. Now, in the other way, let's say it's, shortened. Now we don't have as much length to go for, and we're just kind of moving in that short aspect, that shortened position for that contraction. So we don't get as much strength and power out of our contraction. But when we're in that optimal state, we get that nice power and contraction. So that's a big reason why, if you might be at a plateau in your strength and it's not improving, that flexibility could partially be the issue. Okay, so increased flexibility can help improve aerobic training, muscular strength and endurance, and sport-specific training. Because let's use an example of, let's say, running on the treadmill. So if you're running on the treadmill or even running outside, if you, let's say your hip flexors were tight, or your glutes or your hamstrings, you wouldn't get that optimal length in the legs to be running efficiently on that treadmill, right? So really important for that. Enhanced joint health. Okay, so we'll have the more flexible we are, the healthier the joint will be. Prevention of low back pain and injuries. So low back pain is often the result of tight hamstrings, tight hip flexors. So really important that if these guys are loosened up and the muscles on the other side, such as the core, are strengthened, you will have less low back pain. And of course, injuries, because if, let's say, we've got inflexible muscles and the muscles are shortened, if you happen to move, let's say you do a big stride, or you're playing a sport and you kind of stride somewhere, you are more at risk of an injury and tearing a muscle if you don't have that nice flexibility, right? I always think about flexibility as saltwater taffy. When it's cold, right, and inflexible, it can snap. But if it's warm, it's malleable and it can move, right? Which is what the body can do when it's got that optimal flexibility. Relief of aches and pains. So stretching after a workout, really important, because it helps release kind of that lactic acid buildup that does cause us a lot of pain and discomfort after a workout. So if we do a little stretching after, it will help release that. Relief of muscle cramps. Muscle cramps, like Charlie horses, they're usually the result of dehydration. So if you are getting those muscle cramps quite a bit, I would say probably take a look at your water. Relaxation and stress relief. So, taking that time to stretch and relax is such a wonderful opportunity to just, like we do in yoga, connect the mind and body together and just relax and release and reduce the stress. So important. Like, especially when you think about this after a workout, you're getting that nervous system up, that sympathetic nervous system, that fight or flight is, going, your energy is high. And then if you were to just run out the door like that, your sympathetic nervous system stays high maybe all day and you never relax. Those stress hormones are running high and it's not good for you, right? So a lot of people maybe who are having a hard time losing weight, that's often an issue, right? The stress hormones remain too high, cause padding, because our fat is our protective mechanism, that is it, and those hormones can cause extra padding. So after a workout, take that time. It doesn't have to be long, even if it's 2 or 3 minutes. Breathe, let that body relax. Make sure the sweating is gone. You bring that nervous system back down, turn on the parasympathetic nervous system, and just settle right back into relaxation. Then you can go on in your day in that relaxed state. It'll be so much better for you in the long term. Improve posture and balance. So anytime I do a postural assessment on a client, maybe I see rounded shoulders, maybe I see, turning in of the toes, can always tell when, what muscles on the side of the joint are too weak and what muscles on the side of the joint are too short. And, it's really important to actually have a postural assessment. So I would suggest, connect with me or connect with another health care professional, personal trainer to do a postural assessment to make sure that you're not training on imbalances. What I mean by that is that a lot of people have a lot of imbalances in the body or postural issues and then do really hardcore intense training. And unfortunately, when we do that, we can start to make them worse. So let's say you've got rounded shoulders, which is often a sign of tight pecs, tight chest, tight anterior deltoids. And let's say you start doing a lot of chest because you want your chest to grow. Well, all you're going to do is draw this closer together, rounding into the spine. But, if you roll those shoulders back and down, you start opening into the chest, strengthening the back, lengthening into that chest, your chest will seem bigger, right? And more developed because now we're in that proper postural position. Okay, so I had a student once who I said, why do you train chest so much? I want to know. He was somebody who always seemed to have a lot of chest training in his program. And he said, well, I want my chest to get bigger. I just have never had a big chest and I want it to grow. So I turned him to the side, and just had him kind of, look to the side in the mirror. And, he was standing there kind of like this. And I said, okay, all I want you to do now is to sit up tall. I want you to roll your shoulders back and down. I put him in proper position. And all of a sudden, his chest just popped, right? And he couldn't believe it. He was like, oh, I actually do have a chest. So I recommended at that point that he lengthens a lot into that chest and strengthens into his back. So kind of neat when you start working with the body and you know how to manipulate it. Now, there are some contraindications to stretching, which means if you have any of these conditions, really important to get doctor's clearance before starting a flexibility program, because there definitely are some situations where we don't want to stretch. Okay, some of these are if you have a fracture or a part of your body is healing, you don't want to be stretching it, right? You're just causing more inflammation. You just need those tissues to heal. Okay, so any sort of soft tissue injury, any bone injury, any break. If you have joint hypermobility, let's say, for example, during pregnancy, right? If you can let's say extend into the leg and you could almost push your knee back, right? We want to make sure that we're not hyperextending the joints. So we always want to make sure that the joint is straight but never hyperextended. Any area of infection, so let's say, I don't know, you've gotten a cut or something on the leg, just try to stay away from that area until it's actually healed up. Any sort of hematoma or swelling from a traumatic injury, really important not to be stretching then. Any undiagnosed pain. So a lot of times clients will come to me and say, man, I've had something that's really bugging me here on my hamstring and it feels uncomfortable. I've been doing all sorts of stretching and it just seems to be getting worse. And usually my suggestion to them at that point is stop stretching because there's obviously some sort of tear or something in that body that doesn't want to be stretched. It needs to be healed. Sure enough, they leave it alone for a bit and it starts to feel better. So if you have any undiagnosed pain, what I would suggest is that you do get a doctor to take a look at it, especially if it's been chronic. So you've had it for, let's say, longer than a week or two, doesn't seem to be going away. Definitely have a look by a healthcare professional. If you have osteoporosis, okay, that's brittle bones, specifically in the spine, really important that we're not doing forward folds or side bends, things like that. So, of course, physician's clearance before starting a flexibility program. And if you have a history of prolonged steroid use, so steroids will actually break down muscle and connective tissue. So if you go into a big stretching program, you do put yourself at risk for tearing. So again, physician's clearance before you get started. Really important to listen to your body though, right? And only going when you're stretching to a place that you feel your body wants to go. So let's go through a couple of types of stretches now. So we've got static active stretching, Let's say, for example, we are going to stretch the hamstrings. Okay, so to stretch the hamstrings, let's say in a hurdler stretch, we're going to extend the leg, we're going to sit up nice and tall, and we're going to lean into it. So we're actively pushing our body in towards the stretch, getting to a point of stretch and holding. So this style of stretching is really important after a workout specifically, right? Is holding that nice point of stretch. Okay. Now there's also static passive stretching where let's say you come up onto a wall. Let's say you come here and you place your leg up on the wall and you let that wall help you stretch. So it's more of a passive stretch, but it's static still, right? Because static means still. We're just letting that wall help us with the stretch. Beautiful stretch, actually, by the way. Okay, then the next stretch is PNF stretching or proprioceptive neuromuscular stretching, best done with a partner. So basically, it would be, let's say, for example, you can do it with yourself. Let's say, for example, we wanted to stretch into the hamstring. So a PNF stretch would be, or one style of PNF stretching, let's say, would be to push against resistance. So let's say, you're pushing against you're pushing against your arms, you're trying to push that leg away, and then you release and stretch. It's more of that stretch and relaxing. Push, 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 push. You're contracting into the hamstrings, and then you're relaxing and lengthening into the hamstrings. So this kind of style of stretching usually actually does help you get a little bit further, a little bit deeper. Like I said, you can do it with yourself, but it's so effective if you have a partner or if you're working with a trainer. It's a beautiful style of stretching. Then, of course, we got dynamic stretching, which is where we move different parts of the body, gradually move them. Let's say we're here. This is considered a dynamic stretch. So we're opening the back, opening the chest, right? This sorts of thing. You'll see a lot of athletes or runners do a lot of dynamic stretching, right? It might be simply standing and rocking of the legs, or, perhaps you are just doing any sort of movement here just to kind of lengthen into the joints. Okay, that would be considered a dynamic stretch. And then ballistic stretching is usually a bouncing, right? It's sort of, this kind of thing, right? We're bouncing into that stretch, and it's usually not recommended, that kind of stretching. It's kind of an old school style of stretching. The reason why it's not recommended is because as soon as you're bouncing, let's say you're standing or sitting and you're bouncing like this, bouncing, bouncing, there's something in the muscles called a stretch reflex. Okay, it's deep into little reflex receptors in here. And what those little receptors are doing is they're saying, wait a minute, it feels to me like you might be going too far and I need to protect the joint. So it shortens the muscle. So when we're trying to lengthen into the muscle, we don't want it to be shortened, obviously, right? Then, of course, there's rolling. Okay, you can use any sort of tool for rolling, and I will be doing a whole other workshop on rolling and myofascial release. But basically, you're using a sort of tool, whether you're rolling on a roller or even just simply, with your arms, and you're just lengthening and rolling into that fascia. Okay, so really important. I really love this kind of stretching. It is. I guess it's not really stretching, it's myofascial release, right? But really, really beneficial for just realigning all the tissues in there. And again, we'll go into that detail in another course. So let's go through some common stretches now. So some of my absolute favorite stretches. We aren't going to hold the stretches too long, but when you're doing sort of a basic static stretch style of stretch program, you do want to make sure that you are holding each stretch for at least 10 seconds, if not up to 60 seconds or even more. So remember, if you do want to get into the fascia, we are looking for a 3 to 5 minute style of stretching. So if you're looking for that sort of thing, I would suggest going into a yin yoga program, a restorative program. You can find some of those on my website. But just to get into the muscles, 20, 30 seconds is perfect. Okay. So let's get into some of the common stretches and we'll start with some of the lower body stretches. So one of my absolute favorite stretches is a half kneeling position. So this one is going to get really nicely into the hip flexors. Okay, so this one here, sometimes called a runner's lunge. Now we're going to have the back leg, so the leg that's extended, you're on the knee. From here, the front leg is bent, preferably at an about 90 degrees. Now you'll often see people kind of lean forward into this one. Now I could show you how to get deeper into it, but ideally we want to be sitting up tall and going into a bit of a back bend, right? Because if we are trying to lengthen into the hip flexors, the flexors draw us forward. So as soon as we do this, we're shortening them. But as soon as we go into a bit of a back bend, we're now allowing those hip flexors to open. Okay, so holding here and opening. Now you can make this stretch a little bit deeper if, we are folding forward here, putting the hands on the ground. However, now we're going to push those hips towards the ground and shine that chest forward. So now from here, you'll notice we are in a little bit of a back bend position, even though we're tipping forward from the hip. So really, really nice stretch for those hip flexors. Now, let's take this next one down onto, of course, you would do that on both sides for about 20 seconds. Now, let's take this next one into a figure four position. So figure four can be done in a couple of different ways. You can do this one seated, right, by simply crossing the ankle over top of the other knee, sitting up nice and tall. I like this seated variation because it gives you an opportunity now to focus on that nice posture, shining that chest forward. Holding here, feeling it deep into those hips, right? So we're stretching the glutes, the low back here, hamstrings, piriformis, a little muscle that's deep into those hips that often causes a lot of problems. Another way we can do this one is by sitting in a chair, right? If you sat in a chair, it's kind of similar as the sitting variation. And then also, of course, you can cross and then draw either hanging on behind the thigh or above the knee. So if we go above the knee, it's a deeper stretch. And really important that we do allow the head and shoulders to rest on the ground when we're doing this one. And then, of course, you'd hold here and breathe. Such a beautiful stretch. It's one of my favorites for the hips. Okay, so the next one, let's get into a hamstring stretch. So there's a couple of different ways we can stretch out the hamstrings. Seated variation with both legs forward, right? We would extend into those legs, sitting up nice and tall, leaning forward, and tip from the hip. Now, ideally, we want to have a straight back. So focus on drawing the belly button in towards the spine, sitting those hip bones back. So notice how I kind of went from here to here, pushing the belly towards the thighs and then coming forward. I think a big mistake that a lot of people make is trying to reach for those toes, rounding into the spine, and we just don't get as much length here. So you're better off sitting up a little taller. If you're finding it's hard to push the top of those hips forward, take your hands behind you and start to slowly walk the fleshy parts kind of behind you as you sit those sit bones onto the ground and tip from the hip, leaning forward from here. Really great stretch. Of course, option here is we can also bend into the leg. So when you bend into the leg here, we're going to sit up nice and tall. I really like to flex the toes forward. That gets into the calves, the back of the hamstrings. From here, we can reach up if you want to, or simply come forward. And again, same thing. We're looking for that straight back, kind of pushing the belly onto the thigh, coming in from here. Nice straight back. Now we can also do a hamstring stretch lying on the ground, which is really nice. You might take a towel or a strap. We're going to extend into that leg. If you don't have a towel or a strap, what I like to do is, you can grab onto your pants or just maybe even behind the thigh and focus on extending that leg all the way to the sky. So you don't want to be pushing the knee in, right? Pulling the knee in, because as soon as we bend into that knee, we actually shorten into the hamstring. So we want to extend that leg, making sure that it's straight to get maximal length in that hamstring. If you flex into the toes at the same time, you'll also get the length here in the calves, which often really need it. So the calves come across the knee and come back in here, and the hamstrings will come right across the knee and go underneath here behind the calf. So when we stretch, we're really getting into both of those muscles. Really important to do so. So the next one we're going to do is a little bit of a rotation. So there's a couple, again, different ways we can do the rotation. So a seated rotation, start by taking that right leg and crossing. We'll sit up nice and tall. I always like to encourage people to sit up tall first. Wrap your elbow around that knee and slowly start to turn the chest towards the thigh. Now from here, really important to draw the knee in towards the chest rather than just focusing on the rotation. So when we draw that knee in towards the chest, we are focusing on lengthening now into the glutes. So sitting up tall, lengthen into those glutes. Perfect. Feels beautiful. I love that one. And coming out of this one, I really like going right into that figure four, right? You can go right from one to the other, stretching into the glutes as well as getting into those rotators in deep into the thighs. Now, of course, another way to do a rotation stretch, getting into those glutes, which is really nice, is lying on the back. Start by hugging the knee in towards the chest and then drawing the leg off to the side. Now, you can have that leg straight, trying to keep that hip on the ground, or certainly have a little bit more of a rotation of the spine coming right over to the side. What we're looking for, though, is, of course, that length here in the glutes. All right, next one we're going to get into is the quadriceps. So quadriceps, the rectus femoris is the longest quadricep, and it does come into the hip flexors here. I really like to do this one actually just on the side. So you're going to have your elbow down on the ground, or you can certainly come right down with the head on the ground. You're going to stack the knees on top of the other and then grab the foot of that back leg. Now, what we're looking for is to have that knee in a nice straight line. So we don't have it up, we don't have it down. We've got it in a nice straight line as we push the foot into the hands and push the hips forward. So really beautiful stretch. I love stretching this one down on the ground. A couple of different ways you can stretch those quads. If you come into kind of a kneeling position, so one way you can do that here, right? Getting to that half kneeling position and then pull. Okay, this is a really nice stretch. It's a little bit deeper, okay, a little bit much for a lot of people. And then, of course, standing. Standing quad stretch, of course, standing up nice and tall. I always like to say stay fairly soft in